My name is Ignacio Barra. I'm the regional advisor at PAHO, WHO, the Americas office, our headquarters in Washington. It's a pleasure to be here with all of you today on this activity. We thank you all very much for your participation, for your interest. This is the sixth World Decade of Action for Road Security, Pan American Health Organization, and the World Health Organization through the Non-Communicable Disease and Mental Health Department and the Legal Advisor's Office, where I work. We would like to offer you a warm welcome to this activity where we create a venue where we can bring key actors together who are seeking to ensure our roads are safe throughout the Americas and the Caribbean through holding a open dialogue, including the need to discuss and dialogue, to seek out opportunities for collaboration so that we can be more successful in ensuring road security, especially to strengthen the legal frameworks among our countries. So we have a number of representatives here from different organizations representing road security throughout the continent. Police, health ministries, transportation ministries, parliamentarians, congressmen of national congresses of the countries of America, and representatives of civil society. So I would just like to start with an introduction with some welcoming words from PAHO and WHO, and there's a message that we want to put up on the screen from Anselm Hennis, Director of the Department of Non-Communicable Diseases and Mental Health of the Pan American Health Organization, who unfortunately cannot be with us today. He had some other matters to attend to. So if you would allow me, I will put his presentation up on the screen and we'll hear from him. Buenos días, yo me llamo Anselm Hennis, soy director del Departamento de Enfermedades No Transmisibles y de Salud Mental de la OPS. Quisiera darles la bienvenida a todos los panelistas.
And to you, distinguished ladies and gentlemen, to this webinar titled Facing Together the Challenges of the Second Decade of Action for Road Safety 2021 to 2030 in Latin America and the Caribbean. It is indeed my pleasure to welcome you to this webinar organized by the Pan American Health Organization in close collaboration with our colleagues at the World Health Organization and the Global Alliance of NGOs for Road Safety. This virtual meeting represents an ideal opportunity to have a conversation in the region of the Americas on the challenges that we all face, and to agree on how we can find solutions to successfully implement the global plan for the second decade of action for road safety to achieve the targets to which our countries have all committed. While the COVID-19 pandemic, which has imposed unprecedented health, social, and economic challenges, has revealed to us many of the fragilities of our healthcare systems, the limited capacity of our social networks, and the vulnerabilities of our economies. It has also shown us that when we work collaboratively, we can overcome seemingly impossible challenges and, in fact, achieve tremendous progress in public health. We therefore need to re-energize efforts to mobilize countries in our region to combat the high burden of road traffic injuries. This situation has resulted from the way transport systems have evolved, without the necessary due care and attention to the needs and safety of all road users, especially the most vulnerable road users such as pedestrians and cyclists. Noting that not much progress has been made in terms of reducing the high burden of road traffic injuries in recent years, this new decade of action for road safety offers new opportunities to do things differently in order to achieve so much more. In addition to focusing on the problems that already exist, it is also necessary to extend the discussions with more in-depth conversations about the specific barriers that we are facing from the different perspectives across government and across society, and of course, including the NGOs who are well represented here today, the international financial institutions, development agencies, and the private sector. The purpose of such discussions would be to identify strategic opportunities to overcome existing barriers. How can we coordinate and collaborate more effectively? How can we best join forces? How can we create the synergies and effectiveness on the way forward? How can we maximize the impact of our collective efforts? If these areas can be successfully addressed, we can make significant advances in implementing the recommendations of the global plan in this region. Let us work together in this new decade of action for road safety to build political commitment at the highest levels, combined with the whole of government and whole of society mobilization necessary to resolve this challenge of road traffic injuries and associated mortality. I wish you to fully participate in today's discussions and welcome.
Agradecemos mucho el mensaje del doctor Hennis.
We thank Dr. Hennis for that message. It's a true pleasure to present to you Dr. Etienne Cruz, the director of the social determinants of health of the Pan American Health Organization, the WHO rather, in Geneva, and she has blessed us with her presence today. She speaks perfect Spanish, so we thank you very much for being here. You have the floor. Well, thank you very much. I wouldn't go so far as to say my Spanish is perfect, but hopefully I can make myself understood. A warm welcome to all of you in Latin America, Caribbean, Switzerland here, where the weather is wonderful. A welcome to Senator Mario Fiat, who presides over the global network of parliamentarians working for road safety, and also Senator Patricia Mercado in Mexico, as well as all of our partners in PAHO and the Global Alliance Partnership on Road Security. It's very important to me that we've come together and that we continue year after year. Well, we see 2 million deaths in the roads of the world every year. It's unacceptable, among whom there are many young people, children, pedestrians, bikers, just exercising their right to move about in public roadways, who should not have to die just because they're going to the market, to work, to school. Much more has to be done, and you parliamentarians play a very important role to play. So this is the beginning of a new decade of road security, as declared by the UN or by WHO. This is a very specific set of goals that we seek to put into effect as we go from a transportation system that's centered on vehicles, on automobiles, almost entirely. We have to take back the roads for walkers, bikers, other people not driving a car. This is something that we haven't seen much of in all of the capitals of Latin America and the Caribbean, where our centers, downtowns are chock full of vehicles, and this has led to untold deaths, and we just can't continue this way. We have to have the right laws to speed limit laws, seatbelt laws, and to ensure the enforcement of these laws, lest this legislation be a dead letter. You all play a very important role in fashioning this new legislation to develop global plans and to ensure that they be endowed with the necessary funds and then ultimately implemented. So I'm very pleased that we are all here together to talk about this. We could not improve road safety, but for your contribution. In the General Assembly of the UN in New York, upcoming is a very important high-level meeting, the first of its type, in which heads of state, prime ministers, presidents, and you, parliamentarians, will play an active role, showing that road safety can only be brought about with political will. This isn't a complicated problem that we don't know how to tackle. We know exactly what needs to be done. There has to be political buy-in, political commitment, resolve on the part of our top-level officials. Thank you. Thank you, Dr. Cruz, for that encouraging message. We have parliamentarians here, but also road safety agencies, civil society, and others. So what your words are an encouragement for parliamentarians, legislators to help us in this effort, as I will be stressing in my section, but this is something that's a common effort. Everyone has a role to play. So we thank you once again, Dr. Cruz, for being here with us. Krug, you know, you're a very busy person. So if you have any time, we would be happy for you to stay on. So let's continue with today's agenda. So we have a panel titled Challenges of the New Decade of Action for Road Security 2021-2030 for the Americas, with 4 participants in this block. If you have questions or comments, please type your questions into the Q&A on the Zoom platform. And if your question is directed to a given panelist, go ahead and put that panelist's name in your question. So please use that Q&A icon on the tool bar on the bottom of your Zoom platform. So, Dr. Ricardo Perez Nunez, Road Safety Advisor, Road Safety and Injury Prevention Advisor from WHO PAHO. So we're eager to hear from Ricardo, and we thank him and his whole team for being here. You have the floor, Ricardo. Thank you very much, and I thank all of the different authorities, legislators, representatives of civil society organizations who honor us with your presence here. I would like to share with you some reflections about challenges and opportunities that we face as a region during this decade of action, this year, in which we celebrate 120 years of existence working in the realm of public health. Over the last 20 years, a worldwide consensus has been reached that traffic-related injuries is a high cost that we are no longer willing to pay just to get around. This is a very important public health problem that has manifold causes at different levels, and therefore there has to be an organized response cutting across different disciplines and sectors for us to enable all of the different parts of the transportation mechanism infrastructure to come together. The world plan of the Decade of Action has come up with safe transportation systems that are, again, multimodal, safe, sustainable, integrated, inclusive, and fair or equitable. No road-related injury or death is acceptable, and they can be prevented. And if they can be prevented, then again, no such injury or death is acceptable. There seems to be a consensus around this, and that should be sufficient for our countries to work on this. We need to go from lip service to implementation. Implementing these measures is key, but to do so, as Dr. Krug was saying, there has to be sufficient financing. There has to be a coming together of wills. We all have a role to play. And we've come to see that working separately won't get the job done. But if we're going to work in a team, then there has to be some effort to coordinate these efforts to achieve synergies and to avoid duplication of efforts. Now, it's always easier to say than to do. So that therein lies another challenge, to find a formula that's going to work in each and every one of our countries, because there is no cookie cutter solution. We need to lean on each other. We need to learn from those successful experiences from country to country. That's why it's so important for us to promote these venues, for us to share experiences, to reflect on what has worked, what hasn't worked, where we need to shore up our efforts, what type of help we may need. Ultimately, the big challenge is to get political buy-in at the highest level, to galvanize the whole of society for us to succeed in this effort. I'd like to have you think about some of the different opportunities that we think have emerged in our region. We have some examples of best practices in the region that have been successful. PAHO has compiled some of these experiences this year. We're going to continue to do so to support countries in their efforts. The experience of Trinidad and Tobago, it's the only country in the region that has achieved last decade's goal with the support and the buy-in by civil society. Ecuador's experience, which bolstered its emergency response. Argentina as well, Mexico, whose success story is being showcased by WHO and PAHO. All of this shows us that we can succeed. We're talking about concrete cases that are ever closer to our reality in Latin America, but we know that there are even more successful experiences out there. We need your support to identify them, disseminate them, and then adopt a strategic approach to adopt those success stories region-wide. Bloomberg Initiative is also playing a very important role to showcase successful synergies. This clearly shows us that it is possible to achieve synergies by bringing together the efforts by different actors working together in coordination on different fronts and putting front and center countries and citizens' needs. That's how we have implemented a host of initiatives in public transportation and safety. Some have taken longer than others, but I think that changes have been for the better. Empowering local authorities and civil society organizations is part and parcel of this effort. And we do cooperate in this effort with WHO, PAHO at different levels. a great opportunity that has emerged is for us to learn from the examples, good experiences of others, to seek out ways to broaden these successes to include more cities within countries, more countries in the region. WRI, Ross Center for Sustainable Cities, is an organization we have official relations with that helps to hold workshops, meetings, exchanges, knowledge exchanges, and different approaches to public health and road security. These are joint efforts that we are eager to continue pushing forward to achieve ever more synergies with WRI and other non-state actors. For example, we have joint efforts with the Global Alliance of NGOs for road security, road safety, to hold this webinar, and we hope to continue collaborating with that organization in the future. There are other collaborating centers with which we have achieved certain synergies. Two examples of this are Johns Hopkins International Injury Research Unit that has a number of initiatives underway to strengthen the capacity building of professionals on road security, developed jointly with WHO, the prevention of injuries for low and medium income countries, Global Road Safety Leadership Course. We're also working with the University of California, San Francisco on a medical emergencies. There's a technical publication that they have worked on us with that, and we are waiting for further opportunities for us to continue to strengthen the emergency response on the road.
But the most important opportunity is the technical cooperation that PAHO gives directly to the country. This has been happening in several ways. Regionally, cooperation spaces have been created, like the Parliamentary Network for the Americas for Road Safety, a space to promote dialogue and to coordinate efforts. Subregionally, initiatives like the Middle-American Program of Road Safety and others like cooperation among countries for health development, which is the approach used by PAHO for South-South cooperation, very successful an effort by COSEVI from Costa Rica and Intrans from the Dominican Republic, supported with PAHO offices in both countries, financed with resources from headquarters from 2018 to 2021. PAHO ratified its commitment to offer technical cooperation based on the specific needs of the countries. We have a group of professionals in the country offices that are able to support local efforts. You can talk to the PAHO country offices and we can help you get in contact to them. And this leadership of the country offices has led to a series of publications that have reinforced the work in the countries. Some have taken place with cooperations with NGOs like Fundación Gonzalo Rodriguez and several others that you see here. This joint effort has allowed for the publishing of reports on the state of road safety in the world and in the region. This year, we're coordinating with you the collection of information to build the 5th report that will be published next year. And we thank you all for your support, your participation, and we hope that this information will contribute to the knowledge about the issue in the region and local efforts made to implement the global plan with key information for follow-up and monitoring the work that everybody is conducting. Through these exercises, we identified several opportunities that we need to work on in the region. Here, we're using traffic lights to talk about the care in emergencies that saves lives, avoids permanent damage, disabilities, but only 3 countries have all the components including the care in hospitals for people that are severely hurt, and that's in green. Yellow are interventions with a certain progress, although they're not enough. In red, issues where no progress had been attained until 2018. With the information we'll get this year, the will be more current, but this has to be improved in the region, especially in national systematic evaluations of emergency care, to guide the countries in terms of priorities, to strengthen the performance of their healthcare units from a more all-encompassing perspective, with the leadership of the national road authorities and the Ministry of Health, as well as close monitoring by the PAHO office in Paraguay. We're working with several professionals and authorities to strengthen emergency care. We're going to start this work in other countries as well. The implementation of a new world plan has to be guided and has to have the feedback of local data. When we look at the information of the prior reports, we identified in red areas where we do not have any measurement, any indicator as basic as the ones that you see here. There's an important gap between the information we need to inform decision making and the information we generated in the region. In green are the countries that reported at least in two reports, two measurements, and in yellow, only one measurement in one of the four reports. Another opportunity area for us to work in the countries. There are many institutions, academic and technical, that have developed protocols, methodologies to measure these indicators, but they're not being used by the country authorities. It's important to have this information, but to quantify the indicators, countries should not start from scratch. The opportunity to harmonize data from road safety, maximize visibility, guarantee comparability, and thus report progress is in the last resolution 74/219 from the UN General Assembly, where they promote the collaborative work and using the regional observatories for road safety in the region. There are several. IRCA, for example, there are 8 countries that participate there. And we would like to also work with the different.
Por lo pronto, la OPS lanzó oficialmente la plataforma de
PAHO launched a platform for non-communicable diseases and mental health, and road safety is in this department. The portal has standardized information about deaths and years of life lost by accidents on roads. And below on this page, there's a scorecard that allows you to see the level of implementation of the interventions that were used in the last report of road safety, and that would allow you to identify priority areas. We have to, of course, paint in green the panorama in the region. And we're going to add more information to inform and facilitate the work in the countries in the region. Thank you very much for the opportunity to share with you these ideas, and you can count on us to offer support in the next steps. We want to support all countries so that nobody is left behind. It is clear, as Dr. Haynes says, that together we can do more and better. Thank you very much. Thank you, Ricardo, for your words, for your message. Now, I would like to welcome Senator Mario Fiaf from the Health Commission of the Argentinian Senate, and he is the chairman of the Global Parliamentary Network for Road Safety and a great friend of the Pan American Health Organization. Senator, you have the floor. Thank you very much, Ignacio. Good morning to all. Let me thank the PAHO authorities, as well as WHO, the Department of Non-Communicable Diseases, Mental Health, and the Office of the Legal Advisor for the invitation to participate today. I am convinced that we have a new opportunity to share our experience, especially our concerns in what has to do with the challenges of the second decade of action for road safety. It is good to underscore what we attained in the first decade, but our objective today has to look critically at what we've done, to look in detail and in depth to see what we need to do to, in fact, reduce in 50% the deaths and also the accidents caused by traffic. We need a second decade, but we may need a third and a fourth and more. But that should not make us lose heart. Our work means that we have to be constant. And if we have objectives every decade, it's really steps towards attaining our goal. There's lots to be done, there's no doubt, and it's very hard work together, where we have different actors working together, politicians, legislators, NGOs. It has to be cross-cutting, and we have to work on a roadmap so that we can attain the success we wish for. The world population is increasing constantly. The circulation in roads, streets has slowly been accompanying this increase, but at the expense of the quality of road safety. As a consequence, then, if we do not take urgent steps to monitor the growth in a safe way, we will be continuing to lose the lives and the quality of lives of those who survive accidents on the roads. Science has permanent innovations, all sorts of vaccines, medicines. We have more professionals. We have specialized training, and health research allow us to diagnose and treat diseases like diabetes, AIDS, hypertension. But prevention has become fundamental. Nevertheless, we have gone forward in the prevention of consequences. What we have not been able to do is to prevent the consequences of accidents that could be death or disability. In my country, for example, and according to the statistics published by the National Agency of Road Safety, if we look at the age bracket between 15 and 34 years of age, we can see that road accidents are the first cause of death of those young people. For every victim, there's a whole family, their friends around him that have to face this unexpected and desperate event that generates anguish, hurt, and the consequences that can be physical and psychological. The economic repercussions become even more relevant. when we think about everything that has to be done whenever something like this happens, police, firemen, EMTs, the judicial system that has to work in the investigation, it's a lot. So therefore, the priority should be life, and then, of course, the economic issues. Think about the safe rescue of victims, their transportation to a hospital, to be able to clean up the roads so that investigation can be conducted, determine responsibilities, and also then derive the statistics. The truth is that victims need for rehabilitation. They need all sorts of medical supports, psychologists, physical therapy, so caretakers. Although we want total and quick rehabilitation, not only can people do the whole process, often, in many cases, people are left disabled after an accident, and this disease weight, this loss of health, has a direct impact on the years of age. People suffer. They end up with disabilities derived from the accident, and it's a very heavy load for those who have to take care of them, for the family and for the state. The expenses for that health care are very high. And even worse, if this person was the head of the family, and this often can lead families to extreme poverty. The state also loses productivity and has at the same time offer subsidies, economic help for the person with the disability, and this is a double whammy on the economy. So doubtlessly states have to be preemptive so that this social cost and these expenditures become prevention. The challenge, therefore, is to disseminate as much as possible issues related as road safety as a healthcare issue that has direct implication in all sectors. Taking account then the priorities of what happens when there's a road accident. First is the healthcare sector. We have to ensure that this sector that contributes the most to the care of the victims, their role has to be reformulated, and as well supporting those that use the roads and their families. Healthcare units should not be a secondary actor that helps after the fact. They have to promote prevention. They have the tools, the experience to be able to make people aware of prevention. When a patient dies or is a victim of an accident, they need healthcare unit. They need health care, and the healthcare units are the ones that can offer the necessary care, but also they should offer recommendations so that the patient and the family can become helpers in the prevention of accidents, can replicate the learning that they will give them. These recommendations do not mean only that you need to be careful when you drive. Also, we have to think about the drugs that people take that can change the response time of the driver, or certain pathologies can be a risk to road safeties. If a person, for example, has a stroke or even a heart attack, In Argentina, a few days ago, we saw in the media the news of two French tourists who were run over in Buenos Aires. One of them died, the other one was hurt, and the driver of the taxi had suffered a stroke, or rather had suffered a heart attack, and that's why he lost control of the vehicle. There was also an accident with a truck on the Pan American road. When he was getting near to the toll, he crashed against all the vehicles that were in front of him and the toll booth. And the reason was that the truck driver had suffered a decompensation provoked by an insulin peak. So these things happen in a daily fashion, and we have to disseminate this to work on prevention. Often we hear news of people who truck drivers do not rest enough. Truck drivers and also bus drivers. So this situation, especially in the summer, becomes worse. Truck drivers and bus drivers that drive long distances do not sleep enough. Health conditions us as users of the roads. So healthcare teams have to be able to judge whether a patient can drive or not. As we know that people have neurological problems, heart problems, psychiatric problems, the healthcare providers have to talk about that also. What happens if they take certain drugs, certain medications, alcohols, lack of sleep, and other situations. So a clinical history that reflects all factors that can affect people's reflexes and there's endanger their safety as a driver should be an alarm sign, so that the healthcare providers can look at all the issues that would be in the area of prevention for this patient. So healthcare teams have to have these dialogues with the patients when they come to them for consultations. If you do that, you will decrease the chances of an accident happening. Policies, therefore, have to ensure that healthcare teams participate more in road safety issues, and the healthcare system should contribute to the dissemination of these teachings. And the public sector, doubtlessly, there should be a total involvement from the government, but also individually. And I wanted to share with you a project that I submitted last year that makes each person that works for the government needs to take a mandatory road safety course. They need to be trained and they should receive information in terms of how to do when somebody has a heart attack, how to revive them. So often, if a person sees that an accident has happened, they don't know what to do with the person. So it is necessary that we have more people that are trained in first care, so that they can resuscitate them, that they can also call the ambulance. Often, when there's a fire, people don't know how to use the device to put out the fire. This is the same thing. If you see a person in a desperate situation, people should be trained to help them. If there's somebody that stays with the victim until the ambulance arrives, it's fundamental. Another issue that we have to underscore is industry. We've said that most part of the victims of deaths that are that happen because young people are riding motorcycles. Motorcycles are becoming more and more common. There are many motorcycles, several models, several prices, and there are massive campaigns at the same time for having people buy motorcycles. They are cheaper. They're cheaper to maintain. And so the use has become widespread. And the people who have access to this or who buy motorcycles are younger, and often they are poorer, the more vulnerable economically and socially. This shows that we need to have actions that would offer more protections to these motorcycle riders, and the industry can contribute with new types of helmets that follow international rules, and many other issues that have to derive from the industry. Families, schools, the state, all sectors have to be involved and replicate road safety education, because we all are, were, or will be road users, and that is common to all of us. We need a culture to respect laws. We need to be aware of the risks that happen when we're driving, when we're walking in roads and streets. This awareness should be emphasized in young people, because often they have a culture to not obey laws. Their risk perception is lower as well. That's why we have to work in a permanent fashion. It has to be all-encompassing, cross-cutting with a gender perspective, so that we can attain the sustainable development goals. So road safety has to be a constant process with content, with specific values, aiming at taking care of human life, creating road awareness from children. And if we eradicate road violence, that will be a direct consequence of education and respect for rules. Let's support the organizations of civil society, which were created often by families of the victims, and they have a fundamental role in prevention. They often reach areas where the state does not get to. So all citizens must be able to be safe on the roads, whatever means of transportation they're using. And our actions have to be coordinated, looking at the right to safe circulation. We have to join efforts to make radical changes in the way in which we move in the streets. And because of the sixth World Week of Road Safety, I submitted another bill in the Senate to reduce speed limits in streets. It should not go beyond 30 kilometers an hour. We hope this will be discussed and approved. That's a way in which we can save lives. And finally, Let us make sure that road safety is included in the rules that will lead to a healthy environment. The right to a healthy environment means that you can be safe in the roads because of that. And I thank you again for the invitation.
Thank you very much for your encouraging words, Senator. One of the ideas behind holding this forum is for us to hear the voices of everyone, organizations, institutions, all of which work together with the purpose of reducing or avoiding road-related deaths, road accident deaths. So I thank you for your words. Next, we're going to hear from Dr. Karina Munoz Matos, Executive Secretary of the National Council of Road Safety, Kona from Chile. You have the floor. Good morning, everyone. Organizers, panelists, I thank you very much for the invitation. I thank you for listening in, taking part from all the different countries of the region, for showing your interest in such an important topic. And as we said, this collaborative effort is the most important aspect for us to tackle these topics. I'm going to share my screen with you. Can you see my screen?
Sí, se ve bien.
Ya. Bueno, mi nombre es Karina Muñoz.
My name is Karina Munoz. I'm not a doctor. I apologize for correcting you. I'm an engineer, and I myself use different modes of transportation, and I'm an avid cyclist as well. I come from a civil society. I worked for many years at a foundation that worked on road safety, a global alliance of NGOs, and I've been tied with this organization that I now preside over for many years. Collaborative work is very important. I have a presentation that I prepared. I'll try to be brief. I think we all know what the international context is. This is a public health problem that takes 1.2, 1.3 million lives every year. And a road accident can change someone's life and that of his or her family drastically overnight, economically, socially, psychologically. And so this is a challenge that all countries face. Between 20 and 50 million people suffer either deaths or some type of a traumatic injury every year. Now in Chile, this chart shows the last 2 decades, how many deaths happen on the road. You can see during this first decade, or the last decade, 2002, 2021, there was a leveling off of road accident-related deaths. So we still have a large number of accidents. This is from 2021. You can see the numbers on the screen. 80,000 accidents, 80,000 accidents, 51,000 injuries, 1.6 thousand deaths. And you can see the breakdown, 23% for pedestrians, 4% bicyclists, the rest motorbike deaths. Now, what are the causes? Excessive speed isn't the biggest problem. Well, rather, 29% is what cause of accidents are caused by excessive speed. CONACET exists for the purpose of addressing these issues, working with civil society, because we understand this has to be a collective effort from different standpoints with the participation of the public sector, the private sector, civil society, academic sector, among others. The National Council of Road Safety is what CONACET means. And it's the body that comes up with plans, projects, programs to bring down road accidents in our country. This commission brings together a number of ministries. It is at the ministerial level, and you can see the Ministry of Transportation, Health, Public Works, the Police, Labor Ministry, Public Safety, the President's Office, the Department of the Interior, Housing, Education, Justice. This is our oversight body. Now, the new decade of action through 2030, which seeks to bring down road accidents and deaths by 50%, that's something that Chile has supports wholeheartedly. You can see all the different government organizations that have come together, the academic sector, experts on road safety, civil society, victim associations, have all come together to put together the national policy and a strategy for road safety that sets as a goal a 30% reduction in fatal road deaths. We think that's a realistic goal of 30%. That's why we set it. Our policy, our strategy incorporates many of the measures that are in the new global plan. I would like to stress greater collaboration of all the different actors coming together, building strong partnerships to progress in this area. As we heard at the beginning of this presentation, or at the beginning of today's meeting, that it's no longer time for us to just sit around and talk about this. We have to adopt concrete measures, concrete action. In my experience from civil society, collaborative effort is something that I have seen works best. That's why civil society oftentimes is what makes the decisive difference, pushing for the state to adopt certain policies. Civil society is there to remind the authority that this is an important topic that warrants our continuing to work on it. And that's, again, why I say civil society plays such an important role. So collaborative effort needs to be strengthened. Our strategy has been dubbed Vision Zero. That's a national strategy for road safety, a systemic approach to road safety.
Un elemento estratégico de esta administración y se entienden como un compromiso de cara a la ciudadanía. Por lo tanto, son la hoja de ruta para esta
This is a roadmap, a commitment
esta política y esta estrategia.
seeking to safeguard and benefit the citizenry, and it includes 5 pillars of action. From the first decade, you know what they are, and 152 different measures under each one of these 5 pillars with different timelines, short, medium, long term, within which they should be met. This policy sets forth clear goals, methodology, there are quantifiable benchmarks. It sets priority matters geared toward at-risk groups, children, young people, the elderly, vulnerable users, pedestrians, people who ride bikes or motorcycles. The first pillar, here are some of the lines of action. Road safety. We've got strategic objectives, lines of action, measures, and benchmarks. We have, again, the indicators or benchmarks to reduce deaths among the vulnerable groups, young people, children, elderly, to reduce the number of people who die as a result of excessive or reckless speed and reckless driving, the use of alcohol and drugs, more safety measures such as seat belts and helmets, reducing road or traffic violations, make sure drivers have a license, making sure bike riders have their helmets and motorbike riders, and doing away with the distractions on the road, avoiding excessive speed, dropping the threshold for alcohol and drug levels that if reached in a driver, they lose their license, monitoring and evaluation. These are the indicators or benchmarks we have established. For vulnerable users, we set a goal of 35% reduction in the deaths among these groups. The speed-related accidents we want to reduce to 1.9 out of 100,000 inhabitants. That is speed-related deaths because the drivers lost control of the vehicle because of the speed, and other speed-related violations should be enforced, bringing those accidents down. We want to bring down the degree to which people are driving under the influence of alcohol, reduce people's driving speed, the use of cell phones, drugs, child seats, seat belts, helmets. We seek to reduce the number of deaths caused by alcohol-related accidents by 45%. Other distracting factors such as cell phones. We're really stressing this. That was the second cause of road accidents in 2020. So we see this as being a very important issue that needs to be addressed. Drug use. There was an increase only because we didn't properly measure or quantify its use in the past, and now we do. So the figure has come up. Safety measures, seatbelts, helmets, underwent a sharp increase in their use. So 99% of motorbike riders are using their helmet. 98% of their passenger on the is using a helmet.
En estas reducciones tienen que ver con esfuerzos que se han hecho desde distintas aristas, esfuerzos que vienen desde
Different efforts have been made from different
esfuerzos
standpoints, regulations, behavioral changes that had to be brought about in culture. And all this has called for working together with civil society, which has been working on this for years. And with our organization,
a la reducción en las fatalidades producto de alcohol en la conducción. Tenemos pendiente todavía los etilómetros.
There is the zero tolerance law for driving under the influence of alcohol that was enacted. As a result, another one called the Emilia law, which was something that was supported by civil society. And the result of this is fewer lives lost. Same could be said about reducing the speed within cities from 60 to 50 kilometers per hour per mile. We've been discussing this in Congress for many years. Civil society has really helped considerably to push for the enacting of these laws and their implementation monitoring. The no chatting law, that is writing texts while you're driving on your smartphone. A child seat law, a new law that was enacted in keeping with European and US regulations, making sure that vehicles have an anchor that these child seats can connect to, a check your seat program, as we call it, the public awareness raising campaign geared toward mothers, parents. Use of seatbelts on buses. And also the reminder that people need to use their seatbelts in the back seat as well. That's something that's still pending. And to make sure that helmets sold be certified for their safety. And our big problem, again, is speed-related road accidents, and we're working really hard to bring down that number of deaths, to increase the use of security devices, again, seatbelts and helmets. We're creating a digital driver's license system. And that's one of the ways we're going to address the problem of people driving without a license. And again, driving under the influence of alcohol and drugs, that's something for which is going to be increasing testing. And if you test over a certain level, you're out. Now, we can't sit on our laurels. We still have to keep working. These are the different milestones, laws that were enacted, regulations issued. A law that favors sharing the road between bikes and cars, reducing the kilometers per hour allowed in cities from 60 to 50 kilometers per hour. There are some traffic areas, zones that are where the speed is reduced to 30 for safety reasons. the certification of helmets, and also to make sure that children that are riding in the back of a bicycle be in a proper seat, and that those seats be certified. Bike trails are being created. Other bike safety measures are being adopted and made mandatory. Signage is improving to stress upon automobile drivers that they need to share the road with other modes of transportation. Here's some other examples of a success. Seat belts on buses, drug tests for drivers, ABS brakes for light vehicles and motorbikes, improving our driver's license system, a national day of memory of the victims of traffic accidents, the law that prohibits texting while driving, the Check Your Seat program are all examples. All of that's been quite helpful, but we still have some big challenges ahead. Until we reach 0 deaths, we won't have done enough. So these are the challenges we've enumerated. A labeling project that would provide information on the safety performance of light vehicles, a motorbike plan, that we'll be releasing soon. We have a signage manual that's being updated for people to learn about signage, digital license. That's going to be part of an overall license handling or management system. There's a driver's school standard that has to be updated, a driving test for persons with disabilities that needs to be amended, updated. We have to strengthen our institutions, enhance the quality of the data related to traffic accidents that we receive, that we collect, a license that is point-based. For professional drivers, there's a new practical or hands-on exam that would be administered. A road education course, a formal course for driving teachers and for educators. This point-based license is something that was long in the coming. Much discussion was held to push it out. And again, the formal course for driving teachers and other educators, it's being implemented in the capital, but we want to push it out to the regions. That's all I had to say. Thank you very much. And I stand by for your questions. Thank you, Ms. Munoz, engineer, not doctor. She said, well, we've fallen quite behind on our agenda. We want to hear from the Pan American Health Organization now, or we have rather heard from them. We've heard the congressmen speak and women from a road safety office. And now the time has come to hear from the Global Alliance of NGOs for Road Safety in the person of Marionette Otero, who is the Director of Global Activities. I thank you, Ms. Otero, for being here I thank you for all the support you've given us to put this event together. Thank you very much, Marinette. I thank you, Ignacio, for coordinating this event within the context of this week of activities within this decade of road safety activities.
Vamos, ok. Bueno, como les comentó Ignacio, mi nombre es Mariana Dutero, soy directora de actividades.
I'm Ms. Otero. I'm a global network director for road safety. And it's a pleasure for me to be with you so that I can share some thoughts with you from the standpoint of NGOs for the implementation of recommendations, implementation of these recommendations, and different actions to be adopted. For whoever doesn't know who we are, ours is an alliance founded in 2011 by non-government organizations, 302 of them, in fact, from 100 countries. This is to create an exclusive forum that's devoted to the exchange of experiences, to work together on road safety and to assist victims of road accidents. Again, 302 members across 100 countries in Latin America and the Caribbean. And we hope that these numbers continue to grow, that the number of civil society organizations in Latin America continues to work on this subject of public transportation, mobility, road safety. Anyone who's interested in joining the Alliance, we'd be happy to have you. At the Secretariat, our role is that of to unite, empower, strengthen NGOs doing advocacy, ensuring accountability, providing services to victims. We do this in 3 different areas of work. The work we do as a network, exchanging information. This is a global network, and we disseminate the initiatives that are being adopted locally to make sure that a global audience can benefit from them. Outreach or advocacy, accountability, as I said, to galvanize NGOs through different coordinated campaigns and activities. Capacity building, strengthening technical skills of our members for them to adopt and implement evidence-based interventions. We want to make their advocacy more effective by offering this technical training so that they can better collaborate firsthand with governments in crafting measures. The World Plan, Global Plan, about which we have heard mentioned a number of times, focuses first and foremost on the delivery of mobility solutions and to come up with measures to achieve the reduction of deaths, this at the government level. But also this plan includes other actors, civil society among them, as very important contributors, collaborators in this process of promotion and adoption. This document goes beyond that, setting forth what the role of NGOs is in this global plan, to raise the voice, showcase the academic sector, contribute to foster policies based on empirical evidence, including the community's perspective, having a reliable source of information or providing a reliable source of information to all on road safety, to contribute to maintaining the political agenda. And finally, The global plan is clear, unmistakably clear about how important NGOs are in this effort. We know that if we don't implement all these different plans and programs and ideas, recommendations, we're not going to bring down the levels of deaths. We heard a lot about the challenges we face, but there are three key factors that have held progress back. I know you know what these challenges are, so I'll just try to sum them up. The first factor already dealt with here is that we know what works, we're just not implementing it. We know that the faster people are driving, the less likely it is someone's going to survive an accident. There are aggravating factors and other risk factors that grow at high speeds, yet we still see people driving too fast. All of this information we have on the proper speed at which people should be driving needs to be built into the way we build our roads, make our roads safer. But we continue to build unsafe roads that don't prioritize all users, pedestrians, cyclists. All of that needs to be built into the road itself when built. Now, these evidence-based measures, when implemented, we realize that they are not fully financed. They're not sufficiently financed. That's the big problem, a lack of funding.
But even when there are funds, they're not being prioritized to have a significant impact. There is investment in interventions when there is no proof that they have an impact. The narrative is wrong in terms of their effectiveness. And the governments try to evade the responsibility to give safe systems to users. The World Plan establishes clearly that the responsibility of offering a safe system is in the hands of the government. We all help to ensure the recommendations are implemented, but the one responsible are governments. And governments often evade these responsibilities, do not implement the necessary measures, and say that the worst problem is the users, their bad habits. So people understand that interventions that promote the safety of users have to do with changing their behaviors, placing the onus on the individual instead of looking at the system to see how it contributed to lack of safety and what reforms have to be incorporated. This lack of strategic leadership and political will leads to the intervention of NGOs and civil societies, not assuming responsibilities, but making sure that governments comply with the responsibilities. We know that NGOs, as Karina said, have been working very hard to enact the Emilia law in Chile. Our NGOs work every day advocating for the implementation of measures based on evidence. Later, we're going to be hearing an intervention by the representatives of Movida Segura in Mexico, showing the cooperation between civil society and the legislators to approve the general law for mobility and road safety. This is an example of the capacity of advocacy of civil society, their capacity to work with the government in decision making to create a safe system. This is very important. The capacity to participate in a significant manner, giving a space for civil society to help in the construction of the legislative framework, promoting the adoption of public policies based on evidence. NGOs also have an important role in making governments accountable. We cooperate, we build public agendas jointly, but we also are responsible, we don't just have the capacity, we are responsible to make governments accountable. They have to report in terms of how they are using the funds that have been earmarked for road safety, and that instead of having the responsibility be the system's responsibility, and not just the individuals. And this should include the private sector. In the region, we have in Colombia and Mexico and Chile NGOs that are working directly supporting efforts to make governments adopt rules for the production of vehicles, and at the same time working on legislation. They also work showing how industries try to avoid having the legislative enact these rules. The idea is to underscore the need for the government to establish a legal framework that will more strictly regulate the production of vehicles in the region. And finally, NGOs empower societies, making them demand safe systems for everybody's benefit. And this is the role that we normally associate with civil society, to work to promote good respect for life, and the fact that every human being has the right to a safe mobility without suffering accidents in the roads. So NGOs have to request the adoption of measures based on evidence and safe systems. This is the approach that leads NGOs to share information with the community and the media, to inform them of what's happening, but also to empower them so that they can claim their rights for safe mobility. This claim creates political incentives so that decision makers make the right decisions, and NGOs bring to the table the real needs of the community and a technical knowledge that helps establish the legal framework to meet the needs of the population in terms of a safe mobility system. Understanding the importance of civil society as a catalyzer for government responsibility and the promotion of right to safe mobility, in January and March this year, we work with our members in Latin America to create a call for action for Latin America. The document is a tool to support the advocacy efforts nationally and locally, and also it guides us regionally in our agenda. The document defined the necessary actions to be implemented in the region if we want to comply and contribute to the attaining of the 2030 objectives. I'm not going to read the whole document, we don't have the time, but I want to underscore the central core. After a decade of collective failure, we encourage governments and public power in Latin America to make road safety a national priority, adopting a focus of safe system. We encourage them to ensure legal good with a safe mobility that is sustainable, inclusive, incorporating targets, and for results, implementing actions based on evidence, emphasizing management of speed, the safety of two-wheel vehicles, and offering all-encompassing care for victims of injuries in accidents and their families. The document also talks about specific recommendations and establishes the commitment of the civil society to support the adoption of these recommendations. If you're interested, you can access our webpage and also this call of action for Latin America. You can also see calls of action that were developed in different regions and the global call for action. Before I conclude, and let's see if this works, because videos can be complemented. If not, we'll share it later. I wanted to show this video that we developed in the context of the week for road safety. This is a call to action to decision makers. Let's see if we can hear it. I know the text is in English and it's very long.
¿Se escucha el audio?
No se escucha.
Pues hagamos algo. Lo compartimos y así recobramos un poquito más.
We will share it later, and I think that will we will have more time for other interventions. So thank you all for allowing us to share our experience today. We want to continue this dialogue and cooperation with everybody. I know our members have been very active in the chat box and in the question and answer, so we'll be listening, we'll be hearing from them today. Thank you. Thank you. The truth is that we always thought that civil society closes the cycle. On the one hand, we have the rules, then we have the executors, which are the ministries of health, agencies for road safety, and we need a guarantee that could be the voice of people that have to live this experience. So that is the objective of this dialogue that we want to encourage and maintain. As you said, we won't have time for an exchange, but in the chat and the question and answer, we've all been able to see comments in terms of the need to have better policies. It has to be a national priority given the impact of road safety. I think that's something we need to do. We need to support legislation, but it should not be just a dead law theory. The law has to be executed, and we have to maintain the legislation alive. I will be talking about that, so I'm going to use this comment to as an introduction to the next panel, which are relevant issues for road safety in Latin America and the Caribbean. I will be the first speaker, and I will talk about the legislation for road safety and the Parliamentary network in the Americas for road safety. I have a presentation. I'll try to be brief. I tend to speak too much and I bore people, especially because lawyers often are not as clear for those who are not lawyers. I work in the office of the legal advisor in PAHO, but I work directly with our member states, with the national authorities, with the ministries of health, with state ministries, whenever they request support. And we work intensely with national congresses, with sub-regional parliaments, and we've also worked with the judicial because judges are also responsible for maintaining alive the spirit of the law. All of this is done together with the technical departments in PAHO and the civil society. We are specialists in road safety. But what is road safety? So I found the easiest definition. This was defined by an insurance agency. It should be thought as an all-encompassing system that will reduce risks to people who are walking, who are on bikes, or are driving, so as to reduce accidents and minimize injury and death. So they're actions that aim at encouraging respect for rules for the all of those who use the roads. To know how to act, you need a standard. Ricardo made reference to this report of 2019 about the state of the safety in the roads in the Americas. And let me say that these, which are the most important cause for death in the region, can be avoided with an integrated focus that includes the enacting and making sure that legislation is complied with in terms of risk factors, apply safety rules for the roads, and improve access to hospital care. So we have to look at the norms, the rules, the regulations. In any country in the world, we see a red octagon that says stop in whatever language of the country. We immediately understand what it says. This is an international convention. So it's very important that countries strengthen their local rules, but they also have to remember that there are international parameters that we have to follow. That's what we want to do. Our intervention in your work locally is to contribute to establish communication bridges among all actors. I saw comments in the chat saying the legislators don't do what they're supposed to. There's legislation that hasn't been discussed, is still pending. So our objective is to channel all this effort, not to criticize each other. That's useful, of course, everybody needs it. But I think that it's also important to channel the criticism so we all walk together in the same direction. In the document, in section 2, institutional management, there's a mention to 27 organizations that promote and enact and revise legislation. We are not necessarily reviewing the legislation for its enactment. There's something clear. Road safety is associated to an integral legal framework, but there are certain conditions. If we do not have norms for behavior, how to make people comply with this possibility of making people healthy in an environment, in the environment in which we live. There are certain conditions which are the integrality. We should not think about a cold study of legislations that can be compiled at a world level, that all we need are traffic regulations. There are hundreds of norms, laws, regulations, standards that need to be compilated, because all of that has to be integrated so that it can operate in a useful fashion. The second challenge is implementation. If the rules are not put into practice, if the parameters and the systems are not put into practice, if policies are not assessed, it will be very difficult to attain our objective. Surveillance is the next condition, supervision, and we have to see which are the institutions that conduct the surveillance. There are several. Also, evaluation of the situation of road safety. All of you have mentioned it in our prior presentations, but nobody said what the evaluation of the regulatory framework is so that objectives can be attained of this new decade of road safety, because the documents, the international agreements, the global reports say that to attain road safety, you need regulations, a regulatory framework, but nobody said how do we assess whether this framework is working or not, and how do I maintain it updated? How do I ensure that this framework will continue developing and will be improved? There are certain instruments with recommendations. This is from the WHO. It's called a manual for legislation or manual of practice and resources for countries in several countries, strengthening legislation for road safety. And the handbook says that we recommend the adoption of a progressive plan for the assessment and improvement of legislation. All national safety programs I have read do not say how to conduct the evaluation, how to improve the regulatory framework of these 5 specific risk factors. Therefore, how can we understand the legislative framework if they're not assessed systematically? We have to study laws, regulations, look at the obstacles, and also look at the harmony. And the harmony should be in keeping with the international harmony in these issues. Promote improvement seems to be the best practice to strengthen laws and regulations so as to support the prevention of road accidents. These are the main risk factors. You already mentioned them. There are other factors that we call protectors, such as safer roads and vehicles that need to be regulated as well. I'll give a few examples. In Bolivia, the Senate is planning to include a law that favors that vehicles should keep their lights on during the day. The problem in that country is that given that there's lots of fog in the country, it's very difficult to see other vehicles. So this is part of an evaluation mechanism. When the Senate in Bolivia says, let us work on that, well, why not look at the whole system? We have to work in subjects. And also the care after accidents. It would seem to be part of healthcare, insurance, emergency care, EMTs, more than prevention. And this slide shows a complex system. There are many agencies responsible to attain road safety. In the executive, there are many agencies, police, ministries of health, transportations, road safety agencies, central government programs, all agencies that execute. And from my point of view, they are the main promoters of the verification of rules. Who is the engine here? We have then congresses and national assemblies. Most of the legislation in healthcare in the continent comes directly from national Congress and not from the administrations. Often they follow political sense. Don't ask me why, but health commissions in general are made up by government opposition. And we found a problem there because politics are associated to the development of good legislation. There are other instances for surveillance and verification, and they're not used in road safety. And this is the general supervisors, general audit courts that supervise the government, the committees that the higher audit courts also have a function in the way in which the government operates to ensure plans, programs, international commitments are complied with, but also in the compliance of regulatory frameworks, and ideally to maintain updated the norms and parameters that are included in all international documents and are part of the UN recommendations. We also have the ministries. We have the public prosecutors, judges, that every day face problems such as these, and they have a say. The approach should always be based on people's safety, of people who are inside a vehicle, inside public transportation, but more important, people who are on the roads, in the streets, not inside a vehicle. Unfortunately, when somebody drives drunk, normally the ones that suffer the damage are other people and not the person who drank the alcohol. So we need a clear assessment of what is expected with the legal frameworks so that all actors can have a clearer vision of what has to be done. Insurance companies, for vehicles and damages, often countries have people are freed of responsibility. There's special insurance for people who are under the influence, but they are the people who were suffered the injury is often not included in these insurance policies. So we have to look at that, make sure that third parties are included. And we heard from civil society that they're also responsible in their interventions into the legal framework. And we have different levels: municipal, local, provincial, state, all the different levels of government, plus national legislation. We have several levels of governments issuing different regulations, and we don't often see harmony among those legislations. There's no clear assessment in terms of how the legal framework in the countries comply with the 8, 9 international agreements that regulate road safety globally. There's no clear focus in terms of how human rights are respected, both those using the vehicle, driving the vehicle, or inside public transportation. Senator Fiai was telling us that very few times there is a screening of drivers. In many countries, people who are not qualified drive vehicles with passengers, and this could be a crime. And to think of safe mobility as a pedestrian, as a driver, but as a passenger as well. We believe that is a joint, it's a set of actions. In PAHO, we've assessed this not only from the side of road safety, but also as part of a complex regulatory system that has to be based on a risk analysis. Who manages risks? How do you create standards, rules? Who implements? How do we apply it? Do you do monitoring and evaluation? How do you reinitiate the process with permanent evaluation by national authorities? They are not independent. Everybody should work together so as to reach the objectives we mentioned. I've already mentioned these examples. You also know that the recent resolution by the ONU encourages member states to improve road safety and to consider the possibility of approving legislation about risk factors, and they list some of those. Very briefly, we have some of the possible tools that the parliamentary organization makes available to all of you. In September 2019, we launched a parliamentary network of the Americas for road safety, sponsored by the senators in Paraguay. These are some of the images. And what this parliamentary network wants to do is to invite the legislators in the Americas to exchange experiences, to exchange points of view, to work jointly to see what worked, what didn't work in my country so that others can hear it, and thus we can go forward. We've had 3 meetings of this parliamentary network, and we had to work virtually. You will see there some of the people that are here with us in the picture, and there's a global effort by the WHO which manages this global network for road safety. Senator Fia from Argentina is the first chairman of this global network that has been working for a few years.
These are interactive platforms, and the idea is for it to be easy to create this network. We all need to work together around a common central theme. This is the online platform right here on our webpage, the Parliamentarian or the Legislative Network of the Americas for Road Safety, for anyone who's interested in learning about what legislators are doing about road safety. The first couple of prior pages we were looking at is for the parliamentarians themselves. This part is for anyone who's interested in the subject matter, civil society, citizens, to know where we stand, what still needs to be done. This is intended to be a guide. Now in the Parliament of the UK, they do what's called a post-legislative scrutiny. There's no time to explain it right now. I would just say how important it is for the legislative process to not end with the enactment of the law, but congressmen and women should ensure that the law it enacted is indeed meeting its goals. that is from the legislature itself. The legislature has the obligation to actually make sure that the law the legislator passed is being enforced. Case in point is Chile, that's doing that. Here's a publication about a meeting held in March of 2019 in Quito, Ecuador, about some progress made around the use of this process. PAHO seeks to help in there being technical cooperation made available across country to country from us to you, providing information that would be evidence-based and that evidence be made available, exchange of experiences, international strategies and policies, strengthening legal frameworks. Now, there's a burgeoning database with information about road safety that we're going to make available to everyone. That includes all of the possible standards, policies, regulations that are available in countries on road safety, enabling people to conduct their own evaluations, their own assessment, and to ensure the proper operation of safety, road safety agencies, and also this is a resource for academics. PAHO serves as the secretariat of the Parliamentary Network of the Americas for Road Safety. So I encourage you all to join in this effort for us to forge ahead with all these different activities. Thank you. And now I give the floor to the representatives of the Coalition of Road Safety from Mexico, Alejandra Leal, Areli Carrion, the latter, and also Senator Mercado. Thank you, Ignacio, and I thank all of you for the invitation. And the Road Safety Coalition, I would say it's a very pleasure for me to take part here with the Senator Patricia Mercado, who's been a collaborator of us for a number of years. Yesterday, the General Road Safety and Mobility Law was enacted in the Senate. I'd like to share with you the efforts undertaken together with civil society. The Safe Mobility Coalition is made up by 70 organizations of civil society and other specialists with involving 25 of the 32 states of our country, federal entities as we call them. And we drafted and pushed for the approval enactment of the general law of road safety. These are the different organizations that make up this network. They have been cobbled together over many years through many different channels of communication. We work as a team with different organizations precisely to get different outlooks, perspectives on road safety so that we can work better with authorities. You can see the address to the web page on the screen. Also key in this group are victims, families of victims organizations transforming their pain in civil action. We don't want any more people to die in road accidents, and victims organizations of victims of road violence have played a very important role in this process to drive this message home, as well as collaboration with technical organizations and specialists in creating networks. This effort was coordinated with other organizations that are part of this global alliance. And we've received support since 2020 from some philanthropic organizations. Here we have some data. 16,000 people die in Mexico every year. 40%, more than 40% are pedestrians. We think the fact that there's no coordination mechanism between the three levels of government, you have local roads, state roads, federal roads. There needs to be coordination to define goals and responsibilities. And civil society, of course, plays an important role in overseeing this effort. So in 2014, we pushed for this general road safety and mobility law, published May 17th, yesterday. State legislatures and the Congress now has a deadline of 180 days to enact the necessary reforms to their laws to bring them into line with this national law. It's very important that civil society take part in this effort to coordinate these harmonization efforts across the levels of government. We think that it's through this system that we can ensure a budget be created for the implementation of these road safety measures. One of the key things passed in this law, and this is something that the recommendations made by the World Health Organization helped us with in a comparative analysis that we did of other safety laws throughout Mexico in 2020, which we compared all the public road safety laws in Mexico to collect all of the best among them. There has to be a floor set for everyone. Even though some areas might have even better laws, we need a floor. So the Safe Roads and Mobility Coalition I put on the table some of these measures that had been adopted in other regions of the country that were held up as examples to follow, articulating them very clearly to have them become part of this national floor. The national system. We defined what authorities need to be a part of this national system. Preventive measures like speed limits were defined and put into this law. We saw a great disparity. There still is a great disparity in speed limits between the different levels of government, different types of roads, a local, state, or federal. The level of alcohol and blood alcohol level is also defined in this law. You can see those figures in the first paragraph up on the screen. And breathalyzer tests and other tests need, like blood tests to ascertain blood alcohol level needs to be carried out by the state or by the authorities. vehicles need to be have their safety devices installed, and there are new requirements for informing the consumer about security device performance, the mandatory use of helmets for motorbike riders and their passengers, children or children's seats in cars are mandatory. The having a driver's license is mandatory. It's not. It's banned to speak on the phone while driving. Seatbelts are mandatory for everyone in a motorized vehicle. Also in the law, the rights of victims of road accidents are recognized. A decision-making system is adopted under this law that requires that decisions be evidence-based, and a information system is set up called SITU. Not only do we have the option of promoting and now even drafting legislation with authorities, but also to facilitate the harmonization of existing laws and the ultimate adoption of them once enacted. This law went into effect yesterday. It was a long-standing effort. It's taken many years. As Alejandra said, it was an effort that required the collaboration of many different people across many levels. First proposal was floated to the Senate, followed by many others. As Simon Bolivar said, victory is something that only comes after many defeats. So we've learned about the legislative process along the way. From civil society, we have a right to make proposals, to express demands. And we did fail many times, but ultimately through that process, we learned and finally enacted this law yesterday. From the outset, we had to be very creative and open in holding discussion with all of the stakeholders throughout our countries, all the different authorities, so that we could arrive at a consensus and achieve this unanimous approval. There wasn't one single vote against this bill of law in either one of the houses, the Senate or lower house. And now before us is the huge challenge of actually implementing and enforcing these rules. You can see some of the images up on the screen, how we make use of popular culture. And here you can see some people coming together and discussing different aspects of the law. And we work directly with people, the senators, in fact, who are the ones responsible for reviewing this bill of law. There was a lot of prior work that was done over the couple of years before passage was finally achieved. So again, civil society played an important role, and this is what gave us the opportunity to open up the doors of the Senate to be a part of this legislative process. This was the result of teamwork to not only look at the consider the viewpoint of those on our side, but also that of the legislators who had their role to play. So this was a very informal and a very formal process. We had to hear everyone out, try to understand different viewpoints. We pressed upon the importance of legislating on this subject matter until we could achieve this law. This is just the first step. Our Constitution did not provide any type of powers, faculty to legislate on road safety. So that's the significance of this. Now, there is a constitutional right to mobility at the highest level, the law of the land, the Constitution itself. I understand that Mexico is one of the few countries in the world, certainly in the Americas, that has taken that step of enshrining this in constitutional law, not just allowing it, but mandating it. It is now a right. People have a right to safe mobility. Here are some images.
Images of the long process and work done by the legislator and the organizations. And we have to say that we've made a lot of effort to give technical support to the process, but also we try to be transparent in the way in which we acted to make sure that the talks about the law were made public and involved the organizations that were members of the coalition, uh, including them in the different issues through WhatsApp, through chat, through email. We created a TV program through the internet during the whole process. We've been following this week after week and making giving visibility to the legislators who were working on this, what were their concerns were, what the doubts were, and involving them in this conversation from the local level, the members of the organizations with their legislators, and also the social media. We painted in yellow public monuments in the country. We worked to support this bill, a bill that meant not only you have the obligation to do this, but also bring to the table the learning in a systematized way, and also to have a legal a framework to be incorporated in the vision with specialists in different areas. We organize 5 theme groups using new technologies, social media. We were able to conduct exercises such as this, meetings with specialists where online they study the bill, discuss it, and argue and write down their proposals online. And this was prepared with a legal team that was very powerful, especially women, lawyers, who systematized and summarized the proposals of the specialists in road safety. As you see, the project was submitted. Dr. Miguel Malo from PAHO supported us throughout the process. We wrote the whole bill from scratch. We had nothing like that in the country. So we submitted this law with 199 articles, including what the law should include. And we work with Senator Nancy de la Sierra, who presented the bill formally. There were dialogues with many legislators. Each person that came to us, we said, every time you drink a cup of coffee, a Mexican is dying because of a road accident. So it was impossible to have coffee in the morning without realizing how urgent this was for Mexico. And we made a very big effort to ensure that this dialogue that was based on the demand, the urgency of having this law, that it would be understood by civil society, supported by civil society, not only through a direct dialogue with the legislators, petitions, but also in the streets and in the social media. The members of the coalition said this process is as moving as the World Cup in soccer. We have followed everything. This senator is going to talk now. The other senator is going to talk after. What's he going to say? So it was a very rich debate. We saw that it was a collective effort to learn, to understand the issues, to argue with a basis, an evidence basis. And this, of course, was very good for the legislative process and for us and for the civil society. All laws should really be like this. We should be able to discuss, to have the support of specialists. We were happy. We were very lucky to have the experts in the different areas. We had specialists from the Red Cross, from the groups of EMTs. So we made sure that issues were understood widely. With here another of the actions, embracing the Senate with hearts. We were very professional also in the communication efforts, in our presence in the media, in the press. The strategy was geared to make sure the law was enacted, and it was. On 14 December 2021, it was approved by the Senate. We had the support of Dr. Krug, who sent the country a video congratulating the country for this success. We had long debates. I'm showing you these photos very quickly that illustrate the legislative process. We had open sessions, we had committee meetings, and also meetings in the plenaries of the two houses. There was a lot of creativity by the organizations to be able to follow the vote and the discussions in the House of Representatives and Senators. The families of the victims were very important to open the hearts and the doors of decision makers. We finally, on April 5, got the final approval, and we celebrated outside the Senate. And yesterday, the law was enacted, and we now are working for the implementation of the National System for Mobility and Safety. During the negotiations, this is what we will be working on for the next few months. We began a process sharing the work that we do working at advocacy from different organizations, different countries, and we've been talking to colleagues in Argentina, Brazil, Colombia, Chile, Ecuador, and possibly Peru. Maybe others will join us, and this is what the campaign will be like. No more road deaths, Latin American. We will have a high-level meeting for road safety. And we are trying to use the social media, showing how urgent those actions are. Next steps, national support as we work in Latin America. We have a logo that was created with other organizations. We're going to cooperate with SEDATU, who will be in charge of the agenda in Mexico, to install the national system. Of course, we want to support a public budget for implementation. We need financing, of course, and we're preparing proposals for key articles to update the laws, state laws, to be distributed by the national system. And we are doing an X-ray of the risk factors and working with federal, state, and municipal authorities to build what we need in a year, or in May 2023. We need a national strategy for mobility and road safety in Mexico. It will be the first, and we'll be making a great effort to work with our decision makers so we have a strong plan that will attain the Sustainable Development Goals. So we are very happy to be able to share this success story of great progress for Mexico in issues of safety. We have our champion senator, the chairman of the Metropolitan Commission for Mobility. She was key, and we would like to have more representatives such as you, and we would like to give you the floor so that you tell us how you lived through this process, how we persecuted you, what is your point of view in terms of the Mexican experience. Thank you, Adelia, Alejandra. I really have to put a seal on everything that has been said about this story, a story that we worked on jointly, so that today, and I'm really thankful for this meeting, for this event, because for us it's very significant. Today, the law will be enacted. It was hard work. Not only the story that Alejandra told us, Alejandra Nadelli, it's a very long story, many years. Legislators change, but this is a story of our civil society organizations that accumulated knowledge, ways to communicate, the evidence. They show the evidence of human pain by not having measures for road safety. So when we managed to get this, we were ready to work. And those who were in charge of the commission, I said, if you go, I will follow you, because we need a majority, we need a political will to be able to respond to this request of the civil society organizations, and that's how we began. The organizations were the ones who submitted the bill for road safety, then afterwards a general law ensuring the right to mobility in the constitutional reform. First was the constitutional reform, then the law, the general law, and what we did was say, okay, we're going to take your proposal as if it were a citizen's bill, and we are going to make it our own. So we start to disseminate it in the whole country. It has to have the legitimacy and the knowledge of all the authorities in the countries, local governments, organizations of the civil society in the states. And after that, the senators, were able to officially launch the proposal at the Senate.
So this is a coming together of everyone, a joint effort, and to know who all the different players are, all the different actors, because everyone does their part